So acid reflux is classically a burning sensation that radiates up from the breastbone, heading upwards towards the mouth, and can be associated with nausea, vomiting, water brash, and a general discomfort in the chest region. There are other features that can occur, from chronic cough, painful mouth, painful tongue syndrome, constant sore throats. Indigestion, slightly different. That is a specific pain just under the rib cage in the central region, typically occurring after eating. And that sometimes implies that there might be something going on in the stomach or the small bowel. So both conditions are treated with antacid tablets. Unfortunately, what can happen over a long period of time of suffering from acid reflux is that there are adaptive changes that can occur within this region. Sometimes the stomach cells can march their way up into the esophagus. So they are normal stomach cells, but in the wrong place. And that's a condition we call Barrett's esophagus. And even though those are normal cells in the wrong place, there is a small risk over time that those normal cells can become abnormal cells. So there is a slight increased risk in esophageal cancer in these patients, and that requires surveillance and monitoring. Eating smaller meals more frequently, not eating a big meal late at night, maybe bringing that evening meal down to before 7 o'clock. A diet rich in highly acidic foods or citric fruits, like oranges and lemons, will add more irritation to someone who's already suffering from acid-related problems. Putting an extra pillow under the head end of the bed or underneath the feet of the bed, putting some books just to get a very slight incline, especially if these issues are occurring during the course of the night. If they have had a persistence of symptoms, and especially if they're associated with other features like persistent nausea and vomiting, weight loss, vomiting, especially vomiting of blood, they really need to see a specialist. If the symptoms have continued longer than 6 weeks, or if they have not controlled and settled down on antacid tablets, that's really the time to reach out for help.